I'm a nurse, and this may have been the worst thing I've ever done. Hey guys, welcome to Nurse Talk, the podcast where we talk all things nursing. I'm your host, Mia, and today we're going to be going over some Reddit posts about some nursing confessions. They probably should have kept a secret. Let's get into it. Okay, first confession. I'm a 26-year-old female, have been a nurse for about 5 years, and that's not a ton of time, but I've had my fair share of mishaps throughout my career. Currently, I work as a nurse in an outpatient surgery center. My job is to get the patient ready for the surgery and recover them afterward, pre-op and PACU. During the pre-op period, we connect electrodes to the patient's chest, EKG monitoring, to monitor their heart throughout the procedure and during their recovery. After the patient has had enough time to recover, we take the patches off. This is where I royally messed up. I was taking care of a woman in her 20s. For context's sake, she was small. There are 5 patches I needed to take off as I was getting her ready for discharge. 2 are at the corner of each side of the chest, 1 in the center, and 2 just below the breast on each side. The patient gowns at the center I work at only tie in the back. Some places have gowns with buttons on the sleeves, which can be undone for easier access. My center does not have these. This then means that to reach the 2 lower patches, I have to loosen the gown and reach down the front of it to get them off the patient. In this particular case, this patient was somewhat shy and did not want to be exposed. Her mom was in the room with her, and I offered her as much privacy as I could. I only slightly lowered her gown so as to not expose anything, and blindly reached down to grab the last 2 patches. Sorry, I know where this is going. I pinched at what I thought was the electrode attached to the patch, and I was wrong. It was this unfortunate patient's nipple.
Awkward. It is awkward.
I apologized immediately and quickly went about finishing my task while internally dying. For her credit, she did not really react too much besides turning a few shades red, as I am sure I did as well. I got the patient out and sent her on her way, unable to look at her in her eyes, and spent the rest of the day battling with embarrassment. I told my coworker what I had done, and the story quickly spread around the staff. They all had a good laugh at that. It's not the worst thing in the world, and realistically, it wasn't that terrible of a thing to do, but it's definitely been one of the worst and most embarrassing things I've done this far. Can you just imagine? You're just like reaching in, it's like boop. That's hysterical, and on the grand scheme of things, it's not a big deal whatsoever, but it would probably take me a really long time. Trying to go to sleep for months, and I would just go wide awake. It would keep me up at night. Okay, next confession. When I was in my first couple of months of being a nurse, I was told to shave a man's groin area for the cath procedure that he was having the next morning. Well, I had never done this before, and no one told me exactly how to do it. So I assumed I had to shave everything. Keep it together. I proceeded to shave his groin area, including his testicles. I don't know if this is actually that funny or if I just haven't done this in a while or something. But this is hysterical. Okay. I did not leave one. I can't even read the finishing sentence. I don't know if I can look at it while I read it, but the person stated, He didn't leave.
Get it together, Taurus.
I'm going to do this. Okay. I did not leave one hair on this man's privates. And I was completely mortified the entire time. Especially when I was holding his penis to shave underneath it. I thought these were going to be like deep or something, like someone did something super serious, but this is hysterical. He was mortified as well, but he tried his best not to show it. Well, I was only supposed to shave the area where his femoral artery was located, not his entire groin. 25 years later, I still look back at that and cringe. And yes, he probably is still. And yes, he's probably still scratching and itching his testicles from trying to grow all that pubic hair back. Someone said, "Oh no, that's pretty funny. Thanks for sharing." I would have to agree. I have never laughed that hard trying to finish a story. The story is maybe a paragraph at most, and it took me, I don't know how long, maybe 10 minutes to finish that. That's hilarious. Okay, next confession. I keep seeing posts and stats saying nurses are the #1 profession that cheats. I won't speak for everyone, but I'm a nurse, and yes, I've cheated more than once. Part of it was circumstantial. My ex-husband was an unemployed junkie, so the bar was already in hell. But part of it is the job itself. Nursing strips the illusion right out of you. You don't get to pretend life is long or fair or orderly. That's true. I used to work in a large, very posh nursing home with multiple departments. One day, I was assigned to hospice, providing one-to-one care for a middle-aged man dying of lung cancer. He had his own private villa. Money, comfort, and still a ticking clock. I'd take him out to the patio so he could smoke cigarette after cigarette and drink rum straight from the bottle. I'd make sure his IVs were running, his observations were stable, and we'd just sit there, talking, silence, heavy air. At one point, he looked straight at me and said, "Whatever doubts you are carrying right now, f*** it. Do it. Do whatever you need to do to feel alive, because one day you'll wake up and you'll be me." Then he fell asleep. I opened Reddit and started looking for an AP. That AP is now my boyfriend of 2 years, and yes, we're genuinely happy. That wasn't some dramatic turning point. It was confirmation of something nursing had already drilled into me. I had elderly patients grab my hand and tell me not to waste my youth. I've zipped body bags, I've watched families collapse, and I've seen how fast everything ends. After enough death, you stop romanticizing sacrifice. You stop tolerating misery for the sake of appearance. You start asking why we stay loyal to lives that make us feel dead. I'm now in an ethical, non-monogamous relationship with my boyfriend. I also have 2 female APs. They're both married, and honestly, they're the easiest affairs I've ever had. I'm just one of the girls. We don't talk work together. We all work in different facilities. One works in the ER, the other works in a pediatric ICU, watching children die on a regular basis. If you think that doesn't change how someone approaches love, sex, risk, and honesty, you're lying to yourself. I'm not speaking for all nurses. I'm not justifying anything. It's just my experience, shaped by death, proximity, and the constant reminder that time is ruthless. Take it or leave it. P.S. Used AI to help with grammar. Edit. For some clarification, I am happily divorced for years now and am very happy in a non-monogamous relationship. The point of the post wasn't to encourage cheating, but to evaluate your life as a whole. Thank you for the positive and warm DMs I've been getting. You are such lovely people. To the people sending me hate messages and threats, you'll be blocked, so don't waste your effort. Your hate is yours to keep and deal with. Wow. Okay, that confession was really deep. I loved the way she worded everything. I know she said she used AI. Hopefully, that was mostly her. But it is true. I think nursing changes your perspective in so many ways. You realize truly how fragile life can be. Um, you see young, healthy people get 2 months to live. You see, you know, children and babies and all of these things. You see these people who if you weren't in the nursing field, you wouldn't know how prevalent it can be to see these people go through hardships or even death. And it wakes you up. You're like, oh my God, life is so short. I wouldn't say it made me go down the rabbit hole of, having multiple sex partners and all of these things, but everyone has their own perspective, and we do learn a lot from our patients. And she took what he said literally and she went with it, and good for her. Okay, next confession. I have absolutely no ambition to go any higher. I do not do extra courses or training unless they're mandatory or count towards revalidation. In general, I just have very little interest in my job beyond showing up, doing it to the best of my ability, and going home. Always feel like it's a bad taboo to admit it. Okay, I love this confession because I feel the exact same way. I think it's more than enough to be a nurse. I don't think you have to be an NP. I don't think you have to be a clinician. I don't think you have to be a nurse manager or a charge nurse or any of those other things. And oftentimes we're told, okay, get a higher degree, do this, do that. And no, it's more than enough to show up and be a bedside nurse. I even ended up telling this to one of my managers one time during a evaluation. So during the evaluation, one of the things that we have to do is create a list of all of the goals that we'd like to accomplish. And with those goals, I stated I wanted to get good at X, Y, and Z, or more comfortable with X, Y, and Z, and so forth. And, she stopped and she was like, well, what are your goals of like moving forward? I said, I love what I do. I love my patients. And I love the fact that I come into work on the days that I'm scheduled and I go home, and on my days off, no one bothers me. No one calls me. I said, I never want to get to the point where people need me on my days off. I don't want you to call me when I'm enjoying myself. She was like, oh, okay. And I was like, yeah, I don't want to be a clinician. I don't want to be a charge nurse. I don't want to do any of those things. I want to come to work, do my job, love the babies, do all the things, do my best, and go home. And that's it. And that should be okay because that's the job I applied for, and it's more than enough. That's it. So I agree with this wholeheartedly. Also, someone's confession was respiratory rate of 18. Now, that is something everyone understands. And if you don't, you don't. Next confession. Whether I confiscate your cigarettes or don't depends on how much I like you. This is absolutely true. If someone is pleasant, respectful, and doesn't cause chaos, you'll be surprised how much you'll just, hey, don't do that here. Keep it tucked away and no one will have any issues. Okay? That's easy. But if the patient is rude, unruly, disrespectful, just causing problems, being a menace, give them right up, baby. Next confession. I'm a nurse and I am obsessed with a patient. So I'm an ER nurse. About 2 weeks ago, I had a lovely young woman come in. I kept it professional, but I definitely enjoyed touching her and seeing her breasts.
What the hell?
Now it's been 2 weeks and I can't get her out of my mind. You should have kept that one to yourself. That's so gross. Okay, someone commented, I'm sure she'd like at least one place where all dudes at all times are not gawking at her breasts and trying to get with her. The doctor's office is supposed to be a place someone feels safe, not judged by their physical appearance, either positive or negatively. Do not be a creep. She shouldn't feel weird about coming into the doctor's office or have to find a new doctor because the pervy nurse can't control himself and be professional. Oh wow, the person commented back and said, I keep it totally professional. She thanked me in the end for taking such good care of her. This is a confession thread for the dark side of things you don't want to admit in public. Would I love to just scream, it's a panic attack, not a heart attack, then motorboat the F out of those boobs? Yes, but I don't and can't. I get that. Hence, I have a job. But I still have to expose your chest to get an EKG, and I'm tucking those images in my brain. This is horrible. Someone commented, you need to be fired. Those thoughts stay out of the professional field. You should feel very guilty. Ew, can you imagine if you were the woman that this person was talking about? That would keep me up at night. That was gross. Okay, next confession. When patients present to the ED for BS and start acting a fool, I actively encourage them to leave, subtly. Like when some hero calls 911 for the guy being drunk at a bus stop. And the guy ends up in the ER pissed because now he's drunk at the ER instead of the bus stop where he wanted to be and has no medical complaint. I'll just be rude enough to encourage him to leave AMA without explicitly saying anything that could be quoted later on to show that I was trying to discourage the patient from seeking care. I also make extensive use of a technique I call therapeutic neglect, where I just don't check in with the people who are super needy but medically fine, or the non-medical patients we get who want to suck up all of the time. If they get butthurt and leave AMA, sweet. There's a room we can clean and use for someone who actually needs it and wants help and might actually be sick. My managers keep stressing that we have a very high AMA percentage for our area, but so much of it is due to a lack of appropriate staffing and support, and I just don't give a crap. Are you gonna fire me about it? If so, do it and get it over with. If not, leave me alone and let me try to do my job. Hey, I actually don't disagree with this. When you first start nursing, you want everyone, to have a great experience, and you find it really hard to say no, and all of this stuff is super new. And then you're there for like a year and a half, and someone's like, I'm leaving AMA, and you're like, bye. You get used to it. There's only so many things that you can do as the nurse, and so many people take it out on you because you're the person in front of them. And eventually you get to the point where you're like, if you don't want to be here and you don't want help, see you later. Okay, next confession. The med room is my fart sanctuary. Okay, next confession. I was hooking up with a chief resident during admin time. It just kind of happened a few times. The way we looked at one another when in a group setting was pure fire. Man, I don't understand how people find the time. We've talked about it a couple times on this channel. I have a funny relationship in the workplace video that I'll actually put up here. And you'd be surprised. Go ahead and watch that one. You'd be surprised. Okay, I'm disturbed. Okay. Title: I'm a nurse and I drink my patients' urine samples.
Gross.
This is horrible. Okay. To turn a long story shorter, I, 28 male, enjoy sipping the urine samples of the patients I'm taking care of. It's a guilty pleasure of mine, and I've spent months contemplating what I'd do if I ever got caught and it's been eating at me. I've had a pee fetish since I was about 13 for some pretty depressing reasons, but never had an outlet to express it other than through any advice. I know that there are gross, horrible, just downright crappy people in the world. And I know that they occur in any scenario that life has to offer. But it is depressing when it's in healthcare. This is disgusting. I think if you know that you're prone to feeling certain things, you should stay away from patients, because oftentimes when people are seeking medical care, they are trusting you. When you become a nurse, even if you're like a student, you'll realize that people really trust healthcare professionals. They would never suspect anything. So this is what makes me super sad. I remember when I was a nursing student, I didn't know anything. I was just hanging out, you know. I can get you a blanket, I can get you some Coke or apple juice, but otherwise, I don't know anything. And people were so trusting. So that, taking advantage of really vulnerable people is really freaking gross. So you definitely should have kept that one to yourself. Yeah. Okay. Gross. Someone said you're a sexual predator. Are your patients consenting to you drinking their urine? You have no right to an outlet for this without consent. You should be in jail. Yeah, I agree. Okay, one of the confessions is I called a patient's wife his daughter. Um, I agree with this confession. You should have absolutely told us. No, I think it's funny because, again, when you first start nursing, you're like, oh, are you the daughter? Are you the cousin? Or, you know, and you do say stupid things like, oh, is this your wife? Or is this your daughter? And you realize how important it is to just say, hi, what relation do you have to the patient? And not assume, because a lot of the times you'll be wrong. And it's really awkward and embarrassing. But I think we've all done it before. Another confession. My whiteboard isn't updated. I don't think a lot of people's boards are updated. I have to be honest with you. If I don't update the board, like with my name and the date and everything on report, might not happen at all. You just have to do it at the same exact time every day. And it's not always doable. And no matter what anyone says, it's not the most important thing. So, of all confessions, that's not a bad one. Ew. Someone confessed, once I wore the same set of scrubs 2 days in a row because I didn't want to do laundry. That's so gross. Okay. Okay, another confession. If I work 4 nights in a row, there's a good chance between night 1 and 2, I'm not showering, I'm just scrubbing my pits and naughty bits because a mama is tired. When I first started as a nurse, I worked 2 jobs. I worked a COVID-related job where the pay was way more than I was making at my other job. And so I did unlimited overtime over there. And then I also worked oncology med surge. And so there was a few times that I would work 9, 12-hour shifts in a row, have one day off, work 8, 12-hour shifts in a row, have one day off, work 5, all the things. Y'all would be surprised how often I didn't wash my hair. In and out, baby, in and out. Okay. Last confession. I once, as a junior nurse, gave a large elderly woman a suppository. Let's just say in the wrong hole. Because I thought it was her. You can probably fill in the blanks. Oh my God, that's funny. Okay, well, I hope you guys enjoyed these nursing confessions. I will see you in the next one, but don't forget to subscribe. Bye, guys.